Hello my dear friends, I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today we're talking about patellar reflex. Also called patellar tendon reflex, it's an example of deep reflex. It is used to assess the stretch reflex arc at the level of L4 spinal cord. Muscle spindle fibers in quadriceps, femoral nerve follow the trajectory. Spindle fibers in the quadriceps, femoral nerve, spinal cord L4 level, efferent motor fibers coming back to the quadriceps. All these are tested. What is the procedure? You're going to tap the patellar tendon. Let's take a look. So that's the person's quadriceps, that's the patella. Okay, that's the spinal cord at the level of L4. When you tap the tendon or ligamentum patellae, what happens? What happens is stimulus is picked up by the afferent fibers in the muscle spindle or quadriceps, carried back through the femoral nerve to the spinal cord, where it synapses with the efferent neuron in the anterior gray horn, which then carries this information back to the quadriceps and the quadriceps contracts. What will happen if the quadriceps contracts? Your leg will move forward. Your leg will move forward. What is that called? Okay. It is extension at the level of knee joint, which is the effect of your test. Okay. So when is the jerk exaggerated? When will you have an exaggerated knee jerk? Okay, when you have a motor neuron lesion, when you have anxiety, when you have electrolyte imbalance, you will have a very severe reaction to this test. When do you have it diminished or absent? You're stroking the ligament, but you're not seeing enough response. Loss or element, low motor neuron lesion, or you have poliomyelitis, you have muscle disease. In that case, you will not see an adequate knee jerk to your test. Okay, so a positive patellar tendon reflex confirms functional integrity of L4 spinal segment and femoral nerve, and any deviation can help you to localize neurological symptoms. Please do study this to understand the knee jerk or the patellar tendon jerk. So if you're liking my lectures, do like and subscribe to my channel.